Hello friends, so thank you for being here today, and I would like to tell you a little bit about pre-diabetes and diabetes today. So what I would like to say is I have good news for you today, that both of these conditions, definitely pre-diabetes, but also type 2 diabetes in the early stages, is actually reversible. So this is the good thing. So what you need to know is like the main problem, why do we want to avoid diabetes and what is the problem with diabetes? The biggest problem is diabetes has a lot of complications, and once you have this condition, it is a lifelong condition. So there are two types of diabetes. There is type 2 diabetes, which you get later on, and there is type 1 diabetes, which is actually insulin dependent, which you usually get as a child. So that's not the type of diabetes I'm talking about today. I'm talking about type 2 diabetes, which is the diabetes which usually starts from the age of about 30 onwards, and the risk of it increases with age. The problem with this type of diabetes, well, both diabetes are bad, but the good thing about type 2 diabetes is we can actually reverse it, especially in the first few years. So if you're aware that you have it, then you can do something. So what is pre-diabetes? Pre-diabetes is the stage before developing full-blown type 2 diabetes. So pre-diabetes can carry on for several years, but it's actually a warning sign. So in a way, it is a good thing if somebody develops pre-diabetes and they can be made aware of it, they can do something. It's a warning sign to say, do something and don't let yourself get into diabetes. And I would like to tell you that a person who has been following my tips now for the last 12 months on my WhatsApp group has actually come out of pre-diabetes. So it can be done. It is something that definitely can be done. And what does really help with this is weight loss. Before I go into that, I will just tell you a little bit about the complications of diabetes. So why is it we are so worried we don't want to get diabetes? Because the complications are such that they are very serious. So they can affect your blood vessels, leading to nerve damage. They can affect your organs. They can affect your heart. They can affect your kidneys, your eyes. Now, once you have this condition, the problem is you will have lifelong monitoring of all these. And the risk of developing stroke, heart disease increases manyfold. So this is not a good condition to have. I mean, no illness is good to have, but I would say diabetes is definitely not a good condition to have. So as I said, it's a good thing is that we can reverse these conditions. And what will benefit is if we actually lose some weight. Now, not everybody, you may have seen, not everybody who is overweight, not everybody who has type 2 diabetes is overweight. But definitely gaining weight or being overweight is a risk factor. Now, if we look globally, diabetes type 2 is on the rise. And this is because a lot of it is to do with our lifestyle. So if we make some changes to our lifestyle, this can be prevented. So what I wanted to tell you is that actually Indians are at a higher risk of developing type 2 diabetes. And sadly, in the world, around 2/3 of diabetics are actually of Indian origin, whether they're living in India or whether they're outside of India. It seems to have Indians seem to have a predisposition to develop type 2 diabetes. Now, this could be to do with, they're not sure, their evidence is not 100% clear yet, but it is thought that Indians tend to store their fat mainly around their belly area, their abdomen. That is where our internal organs, which we need, where our pancreas is, where our liver is. So if we are developing a lot of visceral fat, which is fat around these organs, it increases your risk of developing type 2 diabetes. So that is a problem. Now, even if you are thin as an Indian, you still could be at risk of developing type 2 diabetes, because even then, most of your fat could be in that area. The other thing that has been found in Indians especially, and Asians, South Asians, is they seem to have less body muscle. So these are two things that we can do. We can actually build muscle by doing strengthening exercises, and we can reduce our visceral fat by reducing our body weight and in particular the weight, the bulk around our abdomen. And to do that, we have to lose weight. There is no other way to do it other than losing weight. So to lose weight, again, it is mainly around doing exercise, which has multiple benefits, not just reducing the risk of diabetes, but actually it reduces the risk of other problems too, like heart disease. So exercise has multiple benefits, improving your mental health and improving your muscles and reducing your risk of cardiovascular, but also reducing your risk of developing diabetes. But also if you have diabetes, it can actually help you come out of diabetes. So what I would say is the main things I would like to focus on today is number one is diet management. So what I would suggest is that, I have everything in my tips on my group, but I would like to tell you in summary that I would say eat more whole grains, eat more fruits and vegetables, avoid processed food as much as possible. And processed food is food that largely comes in a packet, because the problem with the packaged foods is whether it's biscuits, whether it's any other type of snack, it usually contains a high sugar content. So one of the really important things is we have to take out added sugar. Now, if you simply take out added sugar, means like, obviously everything that we eat converts into sugar. But if you take out added sugar, means take out sugar in tea, coffee, drinks, juices and things, then we are reducing our sugar intake, which could be avoided. So if we can reduce this sugar intake, it will have a large impact on your weight and your chance of developing diabetes. That's one. Two, I would like to say, reduce your portion size. Eat the right portion size. So if you're having 2 chapatis, bring it down to 1 chapati. If you're having 4 tablespoons of rice, bring it down to 2 tablespoons of rice. Increase the content of whole foods like vegetables and fruits. And when eating vegetables, reduce the calorie intake of the vegetables by reducing the oil when cooking. Use healthy oils and actually try to eat a lot of what you're eating steamed. Try to eat more steamed vegetables rather than everything made up into a dish with lots of oil and other things. So that is one thing. Now, also increase the amount of whole grains. Whole grains are very important in our diet, including beans and pulses, and whole grains such as, when I say rice and wheat, etc., it's really important to have it in a form of whole grain rather than processed. So if we have white rice, a lot of it is actually processed. So we need to have either brown rice or any other type of whole grain rice. Similarly, with wheat, it is better to have whole wheat. And it's also good to change your grains, to try and have some, different types of grains. Like there is gram flour you can have different types of millets. You can alternate these grains. You can mix these grains, but have whole meal bread, whole meal atta when you cook. These are really important. On top of it, I would say reduce your animal fat intake. So animal fat contains more saturated fat. Animal fat is basically saturated fat. So dairy products, eggs, things like that, meat, they all contain saturated fat. That is the type of fat we want to reduce. So it is better to focus on plant-based foods. It's a much healthier option. So these things will definitely help in terms of the diet. Also increase your water intake by having more water. You will be well hydrated, and it could reduce your risk of eating more, because a lot of the time when we actually think we are hungry, we're actually just thirsty. So we need to drink more water. But you have to take away your sugar-containing drinks, like Coca-Cola, like anything which has sugar inside it. Please do check labels. I have done a tip just on labels. Please do check labels, and anything containing sugar, I would remove it from your diet, or minimize it at least. Definitely, if you're pre-diabetic or diabetic, completely take it out. So these are the dietary things that need to be done. In terms of exercise, it's very, very important. I would say I would say you must do some strengthening exercises, and the minimum requirement would be 2 to 3 times a week. But you can do a little bit more. You can do it every day even, but just don't overdo it. You don't want to make your muscles aching, especially in the starting. I have included tips on my group on how to do strengthening exercises. And one thing I would like to say is you don't need a gym. You can do everything at home. Yes, when the gyms open up, if it helps you, that's fine, but it's not essential to have a gym. You can do things like triceps dips, biceps curl. You just need a small weight in each hand. You can even have a bag of rice, 1 kg in one hand, in each hand, anything that you have, sugar, whatever you have at home, or you can use weights. You can do that, but you can actually do it without weights as well. You can do exercises against a wall. You can do them on a floor mat. Plank is a very good strengthening exercise for the whole body, and it targets your core muscles. It's a very good exercise. The important thing I would like to stress is it is really important to build up some muscle. And if we can build up some muscle in the core, in the arms and the legs, it is protective against diabetes. Because what happens is in diabetes is that we develop insulin resistance, which means that the insulin in our pancreas, the organ pancreas which produces insulin, although it's producing the insulin, our body starts to stop responding to it. This is usually to do with having excess weight. Excess weight is a really important factor. So we must lose weight and we must build muscle. By building muscle, what it does, it helps us take away the blood sugar into the muscle. So it takes it away from the bloodstream. So what we have to do is we have to focus on our diet. We have to focus on our exercise. But the good news is, as I said, these conditions are reversible. Prediabetes is a condition you cannot diagnose without a blood test. So after the age from about 45, it's really important to have blood tests for everyone, at least every 5 years, to check your glucose levels and to check your cardiac risk as well, cholesterol levels. And it's very important to monitor your blood pressure. So the thing is, once you have prediabetes, we can do something about it. If we end up going from prediabetes into diabetes, we can still do something about it in the first few years. But the problem is, if we don't do something about it and it becomes a long-standing diabetes, the chances of reversing it are very low. The complications risk is high. You can manage it with medication, but the problem is damage has been done at a microvascular level. And once that damage has been done, it's difficult. So it's like then you have to watch your diet all the time. It's not pleasant, and having the complications is definitely not good. You must have heard of people getting a lot of strokes nowadays. We're living longer, so there is a higher risk of developing complications like stroke, like heart disease, like dementia, like cancer, because we're living much longer than we used to. But the good news is there are medications and we can do something to prevent all of this. So please do get a blood test if you're above the age of 45, because even type 2 diabetes can be asymptomatic. And by doing regular exercise, by eating the right food in the right portion size, we can prevent it and reverse it. That's all I want to say today. Thank you very much. Please do follow my tips. They can be helpful. Thank you.